Hello, everyone. Here today we have Dr. Vikram with us, who is a respected specialist in reproductive medicine at University College London Hospitals. He's also a certified menopause specialist from British Menopause Society, and he's a honorable associate professor with University College London. Sorry about that. He has published several articles, and he is extensively involved in research, obviously with menopause and women's reproductive areas. Okay, so what more I would say, we should be, I feel really privileged to have you here, Vikram, and I know that it has been my long term wish to bring you and speak in my platform, and it is like a dream come true, and we are very happy to have you here. And Vic, I just wanted to give the stage, open the stage to you. Or I don't want you to take more of my time with this. I want you to share the knowledge, the experience, and the immense passion that you have on this in educating women. I feel we are gifted to have you here today. Okay, over to you, Vikram.
Thank you. So first of all, thank you, Sharmila, for organizing this. And I know you're doing a lot of work in the menopause space. That's important. Just as we are doing it here in the UK, there is a need for that in India. And people often say, is it about hormones? It's HRT. It's not like that. It's about just knowing what you go through when you go through menopause, trying to optimize your long-term health. So kudos for doing that. And of course, I'm hoping more and more such sessions will happen all across India so that people get to know the ins and outs of what happens during transition and how women can protect their long-term health. Thank you to everyone who's joined, because I know it's a Saturday, it's a weekend, and you'll all have your plans, but you're giving that 1 hour of precious time. So thank you for joining. And hopefully you will take away something useful from this session. And I guess, Sharmila, you're going to record the session so people
Yes, it
who
is.
may miss this session can watch it later.
Yes.
Also, if you have questions, I'm more than happy to take them at the end. So as we go through the session, if something comes to mind, just quickly write down and we can go through that question. Last 20 minutes will be all for you. I also want to learn and listen to your experiences. It's equally about you today. Yes, we have limited time, but we'll hopefully get everything done within an hour. If you have any other questions, you can always put them in the chat. If you don't want to unmute or don't want to reveal your video, that's completely fine. Sharmila is going to take down the questions from the chat and we'll try and answer as many of those before we finish for today. Yeah. So I'm going to share my slides, and again, not complicated slides, just very simple sort of overview of what menopause transition is and what can be done to protect your long-term health, make the symptoms a bit more tolerable. So as soon as I share my screen, I'll open my slides. There we go. And there you have play from the start. Can you see my slides, Sharmila?
Hi, yes. I'll just unpin so that you will take the full screen. Yeah.
Okay. So we'll start with talking about perimenopause, menopause, what are the symptoms, what is the long-term health implication, and then finish with that.
Yeah.
Just to introduce, my name is Vikram. I work at UCLH, which is my NHS hospital. I do a little bit of research with University College London, all related to menopause. I am accredited by the British Menopause Society. I also work at 10 Harley Street, which is my clinic in London. Now, why are we talking about menopause? You must have heard so much about it in recent times in social media, in electronic print media. That's because it's an issue which can affect 50% of the population. More than almost 700 million women are perimenopausal, postmenopausal right now, and about 70 to 80% of all those women will have some or other symptoms of menopause. In fact, women now spend 1/3 of their whole life in the postmenopausal phase. That's a lot of years. That's 20, 30 years of life. And it's important that we invest into this so that those 30, 40 years are healthy, the long-term health is looked at. Some women have terrible symptoms during menopause. Some women have less symptoms, and it's very variable. Symptoms can be unpleasant for many individuals. They can sometimes be quite severe, debilitating, and last up to 10, 15 years. For others, it may be much easier journey. Severity can also vary a lot, but that's why it's so unique, is that every individual will have a different experience, and we need to cater to needs of individuals. Also, menopausal women are the fastest growing work demographic. They are doing some important work there. They're actually teaching or sharing their experience with others who are doing work. And so we need to look after women in these senior roles so they can guide the society further. When and why does menopause happen? Why is it that human beings have menopause? There are very few animal species who have menopause. Why does it happen? What are the symptoms? How do we confirm somebody has gone through menopause? Do we need some test? Do we need to have blood tests to diagnose it? Do we need to have blood tests to have treatment for symptoms? Some of these common questions are what we are going to look at next. So, why does menopause happen? And that's because every woman is born with a finite number of eggs. We call them oocytes. And these eggs in the ovaries will get utilized over 20, 30, 40 years of a woman's life. So the eggs are about million and a half eggs at the time of birth, but slowly, all these eggs in both ovaries will get utilized. And menopause will happen when that egg store, the number of eggs is completely depleted. It's 1,000 or less eggs left. So from million, you're coming down to thousands over 30, 35 years. Once the eggs have been depleted, there will be no more production of estrogen, progesterone, testosterone hormones from the ovaries, and that's when periods will stop and menopause will happen. Just to show you pictorially on a graph, at the time of birth, most women will have about 1.5 to 2 million eggs. And then as these are used up, you'll find that throughout life, those number of eggs will keep coming down. After 40, there'll be very few eggs left, just few thousands around the age of 50. And then, of course, menopause will happen. Now, what are the stages during this process or journey towards getting to menopause? So there are three stages we say menopause process happens or transition happens. Before those three stages start, of course, a woman is premenopausal. That means that no hormone changes have started. A woman would usually have a period every month or two, and the cycles would be regular. She wouldn't have typical symptoms of menopause. That is all before menopause happens or premenopause. Perimenopause is the first stage where things start changing. So hormones will start fluctuating. FSH, LH, estrogen, the key hormones go up and down, up and down. And this will, for most women, happen between the 2 to 5 years, between 40 to 50. So anytime after 40 years of age, some fluctuations in hormones will start. And then, of course, some symptoms will happen. And what are those symptoms in perimenopause? Usually the periods will become irregular. So some women may have very frequent periods every 2 or 3 weeks. Other women may have long gaps between their periods, 2 months, 3 months, 6 months, or more. And with those changes in the periods, will some symptoms may appear: hot flushes, sweats at night, difficulty sleeping, feeling very anxious, palpitations, sometimes vaginal dryness. Those sort of symptoms will start appearing during perimenopause. Then comes the phase of menopause. So when we say menopause has happened, the periods have stopped completely. So after these fluctuations for a few years, maybe 2, 5, 10 years, finally the periods will stop. The ovaries are not making any estrogen now, very little estrogen. And this is usually 1 year after the last period. So if a woman has not had a period for 12 months, that's when we say menopause has definitely happened. And the average age at menopause is anywhere between 45 to 55. A woman may stop periods anywhere within these 10 years. And then after that is the post-menopause. So 1 year since the last period, when the menopause is confirmed, until end of life, 20, 30, 40 years, that's all post-menopause phase, which are very many years. The key to remember is that in perimenopause, although periods may still be happening, they may be irregular, sometimes even regular, symptoms can come up and they should not be brushed away. So women can feel symptoms and may need help with lifestyle, with non-hormonal, hormonal options, and you can offer them even though periods may still be happening. So In the olden times, people used to say, oh, you're still having periods, you can't be perimenopause. That's not true. You can have periods, but you can still have hormones going down, causing symptoms. So you can access different forms of management options. Similarly, with menopause, that's just an arbitrary time point, and there's a wide variation in menopause when it can happen. The symptoms, how bad they are, how severe they are, how long they go on, is wide variation between individuals. So no two people or no two women will have same sort of journey. That's a graphical description of what happens to the estrogen level. Estrogen is the key female hormone. So you can see before 40, 45, when the periods are regular, there's loads of estrogen in the body. In the perimenopause, estrogen levels go up and down, up and down. Some days are good, some days are not good. And finally, menopause happens. There's very little estrogen left. And postmenopause, of course, no more estrogen from ovaries. Very little estrogen is produced by the fat tissue. But the symptoms will usually start in perimenopause. There'll be a little bit of symptoms and then become stronger postmenopause. So for some, the symptoms may only last for 2-3 years. For others, maybe 10-15 years or longer. When does menopause happen? The median age, the average age in the Western world is 51. So in the UK, for example, most women average age is 50, 51, but it's much earlier in Southeast Asian population. So in India, the average age is 46 to 47. That's a massive difference. That's almost 5 years earlier. And so it's even more important that women are told about what to expect during this stage, what problems can happen, and how to optimize their health. Early menopause is when menopause happens between 40 to 45. About 10% of women will have early menopause, and premature menopause is even below the age of 40. So you can have women in their 20s and 30s who can stop periods and go through menopause. That's very devastating for them. That's very challenging because if you're too young and you have menopause, there are lots of physical, psychological consequences which need help. But about 1 to 2% women, 1 to 2 in 100, will have menopause below 40. How many women experience symptoms? About 70 to 80% of women experience symptoms. Some are mild, others have severe symptoms. And about 1/3 out of these 80% will have quite debilitating symptoms. What are the symptoms that we talk about? Because it's all about clinical diagnosis. We don't need to do bloods to diagnose that somebody is going through perimenopause or menopause. It's about symptoms. And if symptoms are present, you can help the individual. And menopause affects almost head to toe. So you can have headaches coming up during perimenopause. Many women report worsening of migraines. You can have brain fog, difficulty memorizing things, difficulty remembering things, low energy, feeling very tired, fatigue, mood tends to go low. There can be onset of depression during this phase. Many women report heightened anxiety, palpitations, irregular periods, which we talked about during perimenopause. A number of women will have classical symptoms, hot flashes, night sweats. You suddenly feel very warm in your facial, chest area, and the rest of the extremities. You can get lots of sweats, which make it difficult to sleep at night. The skin becomes very dry. There may be scalp hair becomes very thin. You may have lots of achy joint pains all over the body. Of course, there can be local symptoms such as vaginal dryness, painful sex, libido tends to be low. These can be other symptoms during the transition. But not just the symptoms. There are lots of long-term health changes there or impacts that will be important during the transition. So, for example, bones. Uh, the bones tend to become less strong as a woman goes through menopause, and we'll come to that a little later why that happens. But loss of bone density, loss of strength of bones can be an issue which needs to be looked after. Heart and blood vessels is another major one. So remember, until the age of menopause, women have lots of estrogen in their body, which is protecting the heart, protecting the blood vessel. It keeps the blood pressure low, it keeps the cholesterol low. But the moment menopause happens, that benefit of estrogen is gone. So women often tend to start having increased risk of heart disease. So making sure the cholesterol is low, making sure the blood pressure is controlled becomes very important. Cognitive function, again, women who have early premature menopause may have difficulties with cognitive function in later life. So, making sure everything is done to protect cognitive health is really important. Again, menopause is associated with loss of muscle mass, loss of tone. So, making sure exercise happens is key. Skin and hair, we already talked about. Another important aspect is metabolism. You will notice that during midlife or menopause, women may start gaining weight. They may start getting fat redistribution. The fat tends to go more around the middle of the body. This is all because of less insulin function alongside, again, estrogen going low. So, making sure that there is some help to improve metabolism, diet, exercise, that goes hand in hand alongside the changes of menopause, what's happening to the hormones. The quick word about the impact on bones, which is really important. Osteoporosis is a condition which does not have symptoms. Most women will not have symptoms when they have osteoporosis, which is fragile bones, and that becomes more common or the risk increases after menopause. In UK, for example, there are so many hip fractures. You can see elderly women having hip fractures, for example, or spinal fractures, and these can be quite a big burden, not only to the individual, but to the society to look after women, as well as for the healthcare system. And why does that risk of osteoporosis or fracture increase at menopause? Because of lack of estrogen, the decreased bone density that happens, and there is increased bone turnover. That means you're losing bone. And there can be lots that can be done to prevent osteoporosis through diet, through exercise, through hormones, and other medications. So most women will have their peak bone mass in their life around the age of 30. And you can see for men, there's a gradual decline in bone density as they get to their 70s and 80s. But look what happens to women. Around 50, 60, when the menopause happens, they suddenly drop their bone mass because of lack of estrogen. So making sure we educate women, we empower them to protect their bone through diet, exercise, intervention is critical. And I'm repeating that because this is one important area that gets overlooked during menopause. And that's just a picture to show you what actually happens microscopically for the bone. You can see on the left hand side the healthy bone with lots of trabeculae, lots of calcium rich mineral. And once the estrogen is withdrawn, the bone density decreases. You can see how thin the bone is. There's lots of empty space there. And it's easy to fracture such a bone. So that's the key for protecting the bone during transition. Now that we know what happens to hormones, there is lack of hormones, and what are the changes, symptoms, and long-term effects of that, let's look at what we can do to improve things. So there are a number of ways we can address symptoms if they are unpleasant or they are severe, and also we can improve the quality of life and long-term health. So lifestyle modification is important. Changes which can be done at workplace, nutritional or self-help interventions are there, alternative therapies, non-HRT medications or HRT. Let's look at each one of them briefly because we don't have a lot of time, but I'll try to cover a little bit on each one. So the first question is, do you always need blood tests to confirm you have menopause? No, it's a medical clinical diagnosis. You don't need to test your hormones. If you're 45 and above and you have menopause symptoms, you don't need a blood test. You may need a blood test if you're very young, below 40 or between 40, 45, and have atypical symptoms. Then sometimes the doctors may do bloods for thyroid or vitamin B12. But most women with typical symptoms don't need a blood test. Is testing required or mandatory to start some form of HRT or other treatment? No, you don't need to have blood tests for that. Is testing required for monitoring changing hormones? No, you don't need it. It's all based on symptoms. Hormones fluctuate, so doing bloods is not useful because they go up and down during perimenopause. What is available? Lifestyle interventions. So what are the useful interventions? First of all, eating small portions of healthy food, and that's Mediterranean type of diet, avoiding excess calories, excess sugars. Sugar is the main enemy for us. Too much saturated fats, takeaway foods is an enemy for us. Having lots of fiber that helps with the gut. Reducing caffeine, having limited coffee tea is fine. Too much caffeine is not good. Moderating alcohol, so again, not having excess alcohol. Nutrition, Try to see a nutritionist if you need further advice, or there are lots of good resources on the internet you can access. Exercising is very, very, very important. At least 4 or 5 sessions in a week of half an hour or 1 hour. You can be yoga, Pilates, running, brisk walking, whatever you enjoy and you can fit within your timetable. Several layers of light clothing can help if you have too many hot flashes. So, using very easy to wear but several layers of clothing so you can take them away if you get a hot flash. For your bones and muscles, vitamin D is key. A lot of us work indoors, don't get sunlight, so vitamin D supplement 1,000 units a day is very important. Calcium can come from food, so if you have good dairy rich diet, you have cereals, eggs, broccoli, that's good. If you don't have enough dairy rich diet, then you can supplement calcium. Weight bearing exercises, resistance balance exercises are very good for bones. So, other than swimming, brisk walking, running, weightlifting, all those are excellent exercises for maintaining bone density if you're not keen on using hormones. There are a number of complementary therapies which some women use, whether it's acupuncture, homeopathy, hypnotherapy. We don't have a lot of scientific evidence for these because not enough good long term trials have been done. Some women find them useful and they continue to access these therapies. And it's your choice whether you want to do these or not, but scientifically, the evidence remains limited. Psychological therapies like relaxation, mindfulness, CBT can be very useful for hot flashes, night sweats, sleep issue, mood issues, and these are again useful as an adjunct. Herbal products we don't recommend. Supplements, herbal products for menopause, which are available over the counter in pharmacy, they don't have a lot of scientific good quality data backing them. So we don't recommend extra supplements other than vitamin D, sometimes occasionally magnesium, but nothing else. Very little evidence for these kind of products. What else is available? For women who may have severe symptoms and want to take medication, you have different forms of medication. One is the venlafaxine, which is an SSRI. It's a kind of antidepressant which can help with flushes, sweats, and mood. You have gabapentin, clonidine. I'm not going to go into too much technical details here, but these are medications which are non hormonal, which can help with flushes or sweats. Some women take them, others may have drowsiness, dry mouth, constipation as side effects, so they may not continue. There's a new drug that was approved this year in the UK and will hopefully be available in India soon. It's called as Veoza. It's called as fezolinetant, which is a non-hormonal medication. It's not HRT, but very useful with hot flashes to reduce the severity and frequency of hot flashes. Again, it's safe because it's not HRT and can be used for women who don't want to take HRT or cannot take hormones. And finally, HRT. What is hormone replacement therapy? Why it's been so controversial, why people are worried about it. It's replacing the three key hormones that women produce: estrogen, progesterone, and for some women, testosterone can also help. There were two studies in 2002 2003, one in the US, one in the UK, which basically said HRT was dangerous. It causes breast cancer, it causes blood clotting, it causes heart disease. And so there was a lot of negative press, fear created at the time that HRT is bad. That's not true. HRT has benefits and risk, but actually, for most women who have severe symptoms, the benefits of HRT are far more than any dangers or risks. And so we now, in the UK, for example, have got nice guidelines which look at the whole evidence, the scientific evidence behind HRT, and they say that benefits outweigh risk. So if a woman is suffering during the menopause, they should really consider this rather than having a bad quality of life. The three key hormones: estrogen gets rid of symptoms, improves energy, it protects the bone, heart, metabolism, prevents diabetes. It has some minor side effects like headaches, breast tenderness, or nausea, but most women will get rid of these in a couple of months. The other hormone in HRT is called progesterone. This is mainly needed to protect the womb lining alongside estrogen. It can help with mood and sleep, but it can have some side effects like bloating or mood changes or PMS like effects. So it's important that you choose the right progesterone which does not give you a lot of side effects. Those women who have a womb will take both estrogen, progesterone. Those who have had a hysterectomy and operation to remove the womb only require estrogen. They necessarily don't need the progesterone. The testosterone is a new hormone. It's the neglected hormone, we call it, because it was not talked about a lot. Everybody thinks testosterone is a male hormone. It's equally a female hormone, and ovaries produce lots of testosterone before menopause. Sometimes during the menopause transition, testosterone levels drop and often cause low libido, problems with sexual function, low energy. And so, therefore, testosterone is mainly used to improve libido or sexual function. And of course, for some women, it will help with mood, energy, muscle, and bone. There are various ways one can take HRT. There are oral tablets, there are skin patches, gels, or spray. There are implants which can be put under the skin of the tummy. There are vaginal creams and pessaries, and these are really important for elderly women who have urinary infections, which are very common. It's usually the vaginal dryness that causes it, and simple vaginal tablets or creams can really help them a lot preventing these urine infections. Mirena coil can be again a contraceptive as well as used as part of HRT. What's the best way to take HRT? We know that patches, gels, sprays are best. Also, a coil can be the best way because they don't increase anybody's risk of blood clots. They don't increase risk of stroke. They're very, very safe to take as transdermal on the skin. We don't advise tablets, especially if you have a risk for blood clotting, but the patches, gels, sprays are very safe. The modern hormones are all coming from plants. They're called body identical hormones. And again, they are much safer than the hormones which were used in the past. So, again, not being unduly scared about HRT or not considering it as a big risk is important because the modern hormones are much safer than what was in the past. And I just talked about vaginal estrogen. It can be used for dryness or painful sex. And of course, for UTI prevention, can be used as long as required. And it doesn't get absorbed in the body because it's in the vagina. So actually, the risk of breast cancer is not increased. You can even give it for some women with history of breast cancer. Now, whether you take a bleed or a bleed-free HRT, some women who've just gone through menopause would like to take a cyclical HRT. That's what we recommend. And then they can go to bleed-free HRT if they've had menopause at least for 1 or 2 years or longer. There are only two risks of HRT we talk about, risk of blood clotting and risk of breast cancer. Blood clotting risk only applies to oral forms of HRT, taking a tablet. So I won't talk a lot about it because in today's world, we don't really give a lot of oral HRT if there is risk of blood clotting. We usually give only patches, gels, sprays, and oral HRT is generally used for younger women who don't have risk of blood clotting. So that's a risk which is almost zero if you use the modern HRT. But more importantly, it's the risk of breast cancer. And everyone talks about this. HRT causes breast cancer. Even the health professionals themselves don't want to give HRT because they're not updated on risks of breast cancer. Let me give you a quick 1 minute overview of this. So, if you take 1,000 women in menopause between 50 to 60, and if you look at the breast cancer rate diagnosis, there'll be 23 women who will be diagnosed with breast cancer out of those 1,000 women over 5 years. If they take HRT, then it will be additional 4 women who will be diagnosed with breast cancer. So the actual risk is so little, it's less than 5 per 1,000 women taking HRT for 5 years. Extremely, extremely small. And then if we look at that risk in terms of what happens with other risks we have in life, look at this. So the risk is extremely small, just 4 extra with HRT. If you look at the risk with the pill, the contraceptive pill, which is so widely used in India or here, is the same risk, exactly the same risk of breast cancer. But nobody talks about that risk when the pill is prescribed. So women get given pill for contraception, get given for heavy bleeding, but actually the exact same risk as HRT, but everyone is scared to prescribe HRT. Look at alcohol intake. 2 or more units of alcohol per day, the risk is higher of breast cancer. Smoking, the risk is similar. Look at weight gain. A lot of women may gain weight during midlife and have overweight or obese. The risk of breast cancer is huge. It's 24. It's much higher. The HRT is nothing compared to that. But we don't talk a lot about weight optimization, making sure the weight is good, making sure diet exercise is optimum. It's all about a negative press for HRT. So the message I'm trying to convey is, if you're suffering during your menopause, then there are lots of things that can be done, including HRT, which can be very safe, and the benefits will outweigh any risk of breast cancer. For women who have early or premature menopause, none of this applies. They can take hormones safely. There is no increase in risk of breast cancer until the age of 50. They can absolutely safely take HRT. So, how long, if somebody chooses HRT, how long do they take it? Usually for 5 to 10 years. There's no upper age limit, but most women will use HRT, say between 50 to 60, 50 to 65, and thereafter they will come off it. But as long as benefits outweigh risk, you can continue. But it's not all about HRT. Today is not about hormones. It's about understanding what happens during menopause. What are the different changes that happen? Why it's important to protect bones, protect heart, what are the symptoms to recognize, how can we use various lifestyle, non-hormonal options to manage them. And remember, everyone will be unique. So every woman will have a different menopause, different symptoms, and different ways to manage their menopause. Menopause should be viewed as an opportunity to make changes in lifestyle, which will improve your health, have good diet, good exercise, regular screening in future for bone, work-life balance needs to be addressed, and of course, stress relief, mindfulness. All these are individual topics which you can look at during this transition so that your next 20, 30, 40 years can be healthier with best health outcomes. So that's from me. That's a quick sort of rapid fire summary of where we are in menopause today. Thank you for listening. Thank you, everyone, for giving up your time today to join us. I'll be happy to take any questions if you've put them in the chat, or Sharmila, feel free to ask me any questions, or you can unmute yourself and ask me any questions. Thank you.
Yeah, feel free if you. I think we can take questions. You can raise hands or just unmute and talk. I don't see any questions on the chat, so I would request that you can directly unmute and talk. Ask Doctor. Thank you for the lovely session, Vikram. First, I forgot to mention that. Please, all of us just give a thumbs up or something. Just as he has taken the time, his personal time, to be here with us and share his experiences. So that's lovely. This is support. This is the very first episode, and we will be continuing with more recorded sessions.